Good evening. My name is Steve North, and I appreciate everybody coming and joining us for the Eleanor Health Asheville Virtual Open House. I'm the State Medical Director for Eleanor Health, and I live in the mountains of Western North Carolina. For the past 14 years, I've been practicing at a rural health center in Mitchell County. Eleanor Health provides whole person, individualized treatment for substance use disorders through a network of outpatient clinics across the state of North Carolina. And in the last 3 weeks, like most health systems in the state, we have added a very strong virtual component and now can provide 100% of our care virtually. This open house, and you're attending it, plays a great role in our goal of becoming a part of the recovery community in Asheville. We want to partner with primary care docs and specialists, with therapists and community resources, with the city and county government, with those folks who have been here and been working to address substance use disorders for decades. While we normally like to meet all of you in person and have these discussions one-on-one, the circumstances we currently exist in are not allowing us to do that. So thank you for joining us tonight here in this virtual space. I would like to touch on two quick things. Lots of people have found the chat on the right-hand side. Please keep using that. And also, questions and answers are going to be welcome throughout the event. Please post them in the question and answer box that can be found on the bottom of your screen. Thank you very much. You'll hear more from me later on, and I'd now like to introduce you to our co-founder and chief executive officer, Corbin Petro. Corbin.
Thank you, Steve. And thanks to all of you for joining us this evening. We're so happy that folks from the Asheville community are here with us. And I'd also like to welcome the members of the Eleanor team who are with us, including those from our other clinics in North Carolina, in Mooresville, Durham, High Point, Hickory, as well as our national team and statewide team in North Carolina. Eleanor Health's mission is to help people with addiction live amazing lives, and that mission is more important now than ever. These unprecedented times have added stress, anxiety, and isolation to our lives, factors that significantly impact those with substance use disorders. It's critical that we continue to provide a shining light for people who need that support, and I'm so proud of our team for all their work that they've done to stay committed to that mission and to continue to reinforce that we can deliver 100% of our model virtually. Eleanor Health was founded with the goal of expanding access to the highest quality evidence-based treatment, including the use of medication-assisted treatment and addressing whole person, non-clinical aspects that are so important to retaining a person in recovery. I'm about to hand it over to our Chief Medical Officer and co-founder, Dr. Nzinga Harrison, to talk a little bit more about our clinical model, but I wanted to share a little bit about what you can expect tonight. First, you'll hear from a number of us on the leadership team. We're gonna provide a video tour of our clinic, and then we're gonna get into a Q&A where we hope you'll provide your questions for members of our team across the state and nationally to answer. So with that, I'm gonna hand it over to Dr. Nzinga Harrison.
Thank you. So as Corbin mentioned, I'm Dr. Nzinga Harrison, Chief Medical Officer and co-founder of Eleanor Health. I'm a physician. My specialties are adult general psychiatry and addiction medicine. I won't say too much besides every one of our grand openings has been bigger than the last, but holy smokes, you guys have knocked it out of the park tonight. This is the biggest grand opening we have, and in many ways, a true testament to how we want to join communities and be there in the greatest times of need. So coronavirus has turned everything on its head, but we knew, as Corbin said, that living our mission to help people with addiction live amazing lives is so important now than ever. And so while this is our Asheville grand opening, this is also a kickoff to us being able to serve everyone in the state of North Carolina through our purely comprehensive and virtual care model. I don't want to miss introducing our third co-founder, who is Shristi Merchandani. You hopefully see her video there in front with the beautiful library of books behind her. You'll hear more from her later on about Eleanor, but for now, about Eleanor Health. But for now, I'll pass it to Brandy Berger, who is our lead clinician for the Asheville Clinic.
Hi, thank you for that introduction, Dr. Harrison. My name is Brandy Berger, and I am the clinic manager for the Asheville office. I am a licensed professional counselor and a licensed clinical addiction specialist and have been practicing in the field for over 10 years. I am very excited to be helping serve those in the community of Asheville who are struggling with addiction, and I can't wait to help them live amazing lives. And back to you, Dr. North.
Thanks, Brandy. We're glad to have you on board. Bennett, can you start the video for us?
We're incredibly excited to be opening our clinic on McDowell Street. I think it's challenging during this time. Obviously, we're all confronted with social isolation, with the coronavirus, and really opening our doors in a virtual fashion is exactly what the community needs right now.
When you walk in Eleanor Health doors, whether that's physically or whether you virtually walk in, you will immediately feel that we appreciate your inherent value as a human being.
We're first to market when it comes to a unique payment model and care delivery model around substance use disorder and addiction. Our evidence-based care model includes medication, which is shown to reduce relapse and support people's journey through recovery. Next, we provide patients with therapy, individual, group, and telehealth delivered therapy. And then we get to those whole person components, which are delivered by our community recovery partners, which are peers, those with a lived recovery experience. And those folks really are the glue to our model.
It is our intention to join the community, work on stigma reduction, work on education, figure out what continuum of treatment exists in that community, and help to fill in the gaps.
Eleanor brings together the team needed to care for folks who struggle with complex substance use disorders and complex medical problems. We take a whole person approach and use a harm reduction mindset to try and overcome the barriers to recovery.
And so every person gets a comprehensive assessment that includes a medical assessment, a nursing assessment, a psychiatric screening for anyone who screens positive, psychiatric evaluation and medication management as needed, as well as an evaluation of the social drivers of health, stress, support system, meaningful connectedness. And we really use that information to develop an individually crafted treatment plan.
Eleanor intends to develop close partnerships with primary care providers. We want to help you by using our skills to treat the substance use disorder.
Hello, my name is Neil Guffey. I'm one of the physicians that does MAT for Eleanor Health and find it to be quite different than other MAT programs I've interacted with in the past. The difference with Eleanor Health is the extra steps it takes to make sure that the community members really have what they need and feel supportive.
The Eleanor Health model is integrated. Asheville understands the purpose of integrated care and why it doesn't make sense to just treat one part of the body as if the brain is separated from everything else. We're different from other addiction treatment providers in that we will never fire you for your addiction.
How fortunate we are to have Eleanor Health in North Carolina. The foresight of the founders and leaders, Corbin Petro and Nzinga Harrison, is unparalleled. They set out to build a truly differentiated model of care for substance use disorders. People are truly seen, and their strengths are drawn out and built up to drive that path to recovery. I am humbled every day by the work of Eleanor Health, and I'm excited that this team is ready to serve in Asheville.
When you join our community, as a population, our community members' lives are getting better and their health is getting better.
So we deliver the best in evidence-based treatment in our care sites, and then we extend the footprint of those clinics through technology. 100% of our care model can be delivered virtually.
Many practices take an approach of complete abstinence. At Eleanor Health, we know that people wrestle with polysubstance abuse. And our goal, first and foremost, is harm reduction. We want to prevent people who seek care with us from dying.
Recovery capital changes over people's lives. During COVID-19, a lot of people have lost a lot of recovery capital. And if your recovery is worse, give us a call. We can help you think about other ways to increase your recovery capital to help give you an edge to get back to sobriety.
I love this phrase that we use, hashtag recovery for life. Your life can be amazing.
Hey, thank you very much. It's great to see that video, and we're already starting to get some comments in across the bottom. So first off, right off the bat, we've got a question from Jessen Hall, and he asks, how does Eleanor Health wrap in professionals like peer specialists and social work interns into the clinical role to include ongoing virtual professional development? Wow, Jessen, that's a tough question, and I am going to try to toss that over to, I'm going to toss that over to Nzinga Harrison and ask her to take the first crack at that.
Thanks, Steve. So if you'll just repeat the question for me, it's how do we...
Yeah, the question is, how does Eleanor Health wrap in professionals like peer support specialists and into the clinical role?
Yeah, so I actually really love this question. We have this concept that's part of our culture at Eleanor Health, which is getting away from the vertical dynamic that you typically see in healthcare that says like the doctor has the most authority, followed by the nurse, followed by the clinician, and often forgets the person who's being served, into this horizontal dynamic that says every single person on our team, the member we're serving first, has equal expertise, value, and importance in that relationship. So that's our community recovery partners. They are the absolute quarterback and linchpin of our care model. We couldn't do that without them. Their lived experience with the clinical expertise, the medical expertise, the nursing expertise, and very much importantly, the life experience of the person we're taking care of defines the Eleanor Health model. So it's not how do we use them? None of us could deliver this model without each other.
Great. Thanks, Nzinga. Next question is from Amy Upham. Amy asks, I see you accept Medicaid. Do you all have any slots for the uninsured? And I'm going to put that one to Corbin.
Thank you, Dr. North, and thank you, Amy, for your question. So absolutely, when we enter into a community, we look to serve as many individuals in that community as possible. So that means those who have commercial insurance through their employer, those who have Medicaid, those on Medicare, and in North Carolina, incredibly important to serve those who are uninsured, which we've done to a great extent in our other clinics, and our intent is to continue doing that in Asheville. We do that through a scholarship program where we both donate our time and we seek resources from organizations who donate to us as well. So that's a big part of our model, and obviously important when we enter into a community.
Great. Thanks, Corbin. Another person in the audience says, could you provide more details on your virtual care delivery? Can you really do everything without someone needing to commit? And I'm actually going to take that one myself. So I feel that we can. We have a robust digital platform, and we are working to do things such as urine drug screens by sending the cup to the patient, and have developed a protocol to do a not directly observed, but have them show us the cup after they've used it. So we're really working to decrease barriers to access. And right now, to place someone at risk to come into our practice for a urine drug screen does not seem to be appropriate. Our next question is from Carol Rose. How do I point someone to you who is in need? Anyone on call after hours and weekends? Hannah, can you take that?
Yes, we have after-hours service with Stericycle that does a first screen. We also have on-call medical staff and clinical staff available, and we have an on-call structure.
Great, thanks. And we're going to put the contact information for the Asheville practice in the chat box for everyone. Donald McDonald asks, how do you train and screen your peer workforce to ensure they've explored and resolved any internal biases they may have against medications for opioid use disorder. Hannah, I'd like to send that one back to you.
Absolutely. Part of our pre-screening questions for all of our staff are regarding harm reduction and their commitment to helping the folks we serve stay alive, and following research-based practices, which include the use of medication-assisted treatments where it's indicated. We also seek to hire peers that have quite a few years in recovery. Our peers range from 5 to 20 years in recovery, and they're a fantastic part of our workforce, and they're very much advocates for our members that we serve to recover in whatever way works best for them.
Great. Thanks, Hannah. Dr. Rachel Keever asks, do patients need pre-screening or initial psychiatric care prior to making a referral to Eleanor Health? And what is the current process for referrals? Dr. Harrison, do you want to take that?
I would love to take this. So the short answer is no. We have psychiatrists and psychiatric mental health nurse practitioners on our medical team. So the only thing that a person needs to be referred to Eleanor Health is to be, at this time, 18 or over. I promise adolescent program is coming soon, thanks to Dr. North, our adolescent specialist. So 18 or older, living in the state of North Carolina, and having some trouble as defined by them with alcohol, opioids, or other substance use disorder. You'll notice that I didn't say they have to be completely and utterly ready to stop all substances, because that is not a criteria. 18 in North Carolina wants help, and you can refer to us online. We actually dropped the online referral form in the chat box. You can get it off the website. A person can call us. A person can walk into our clinics. So we have tried to make this entry as free of barriers as humanly possible. And we screen everyone for psychiatric needs and take care of them as we go along with the substance use disorder.
And I want to add that substance use disorders include tobacco dependence, which is extremely important during COVID-19.
The next question we have is, the video mentioned how Eleanor really pays attention to members and their needs and asks for some anecdotes. Candace Joyner is our Durham clinic manager and is an LCSW, and I'm going to ask her to take that question. Candace? All right, there you are.
Could you repeat that question for me, Dr.?
Absolutely. So the video mentioned how Eleanor pays attention to members and their needs. Do you have any anecdotes or stories of individual members that sort of exemplify what it is that we do?
Yes, at the onset of the discussion, I think it was Dr. Harrison that let you know that we do not give up on our members. Once you come into the Eleanor family, you are part of Eleanor for life. And so one story, we had a referral back in January of a member that wasn't quite ready to engage, but we called her weekly, set up appointments with her, and just weren't able to get her to physically come into the clinic. Then about a couple weeks ago, we were able to pivot to virtual care, and we called her, and she has since been able to engage in treatment. She's linked with MAT, individual and group therapy. She's also had nursing visits and is really linked with our community recovery partners. So that's a great example of how we don't give up on anyone that is a part of Eleanor, and how we shift considering the demands in the community, and are just able to wrap our arms around our members.
Excellent. Thank you very much. And next question is from Thomas Cospita. Do you work with and refer to harm reduction organizations if patients are in active use? And Hannah, you want to take that one?
Absolutely. We work with harm reduction organizations both locally. We work to build recovery-oriented systems of care. And one of the first tasks of all of our clinic managers is to build resource guides for their teams. And we don't want to just take the resource guide that other nonprofits have created. We want to make sure that the primary care doctors we're referring to have a harm reduction and affirming, respectful approach, along with every other aspect of care. And then our senior leadership team also works nationally.
on harm reduction approach policies on the state and national level. And we're also, our senior leaders are members of wonderful coalitions advocating for changes.
Great. Thank you very much, Hannah. Another person asked if we have plans to open in Wilmington. Corbin, do you want to take that question and talk about our expansion plans?
Be happy to, Dr. North. Our plans include opening a total of 10 clinics across North Carolina. We're halfway there with our Asheville clinic. Actually, our next scheduled clinic is in Wilmington. I don't know how this brilliant person knew exactly where we were going next. After that, we're still exploring what parts of the state to enter, likely through partnerships with provider systems. Again, as Dr. North said at the top of the call, really looking to partner with primary care and other places in need. And so looking in some of the more rural parts of the state and continuing to go east are part of our expansion plans. Thank you for the question.
Great. Thanks a lot. Someone asks, what's the story behind the name Eleanor? Shrishti, can you take that one?
Absolutely. You know, this is my favorite one to talk about. The story of why Eleanor, if you'll bear with me, actually has a few dimensions to it. Our namesake really, first of all, has the Greek meaning of shining light. We at Eleanor really strive to set this paradigm in addiction treatment for individuals and for communities, that we provide this steady, constant shining light that illuminates a path for recovery for those impacted by substance use disorders. But secondly, it's also that by naming our organization Eleanor, it really conveys our dedication to people, individual members, each with their own unique story, that seek support from Eleanor to be that strong, resolute, and trustworthy presence in their life. And we fundamentally believe, as Candace was just describing, in that power and that innate ability to get better. And the epitome of that name is Eleanor Roosevelt, a connotation that many have with the name Eleanor. But Eleanor Roosevelt, as a reminder, was an incredible humanitarian who left this legacy of advocacy and action for those who were underserved, as well as around universal human rights, including the right to health. And we at Eleanor are really focusing on opening our doors, both physically and virtually, as wide as possible to provide the highest quality care for substance use disorders as accessibly as possible to those who need it, and towards this individual reclamation of universal human rights that Eleanor Roosevelt championed.
Thanks, Shrishti. You tell that story better than anybody I know, so I really appreciate you doing that. So looking at the questions from the crowd, Eric Branning asks if we can talk more about the wraparound services for recovery that your model provides, including therapy. Why don't I toss that back over to Hannah?
Wonderful. So we have an interdisciplinary model within our program. So every single person walking through our doors, virtually or in person, gets a clinical assessment from a nurse care manager, from a medical staff person, whether an MD or NP, from a licensed clinical therapist that's independently licensed, and also from a community recovery partner, which is our peer position. And for the course of care, you may have different mixes of services. We have group therapy, individual therapy, in addition to ongoing nurse care management, and then recovery coaching type services to help break down recovery capital barriers. For medical services, we have psychiatric services, both the clinical assessment and ongoing psychiatric care if that's needed. Some of our members have external psychiatric care, and we love working with other providers. We also provide ongoing medication-assisted treatment if that's warranted, and ongoing medical assessment of any needs related to their care. We have an OBGYN on staff in North Carolina that helps with all of our pregnant patients as well.
Great, thanks, Hannah. So a question from Shell McCall. Do people need to have gone through an official intake in order to participate in the current virtual supports for those in recovery, for those in active use, or the family support systems? Nzinga, can you take this one for us?
I can. I thought you were going to take that one, Steve, because I have to give special shout out to Steve North and Hannah Van Riggemorter, who led the team to develop our virtual intake process. just 1 week after social distancing started, we were able to accept people purely virtually from brand new. So we have a HIPAA compliant virtual intake, we get heart rates, we can do CALs, we get our urine drug screens, all of it without the person ever having to leave their home. We first developed that for folks who were in high risk groups to protect their ability to access substance abuse treatment services while staying at home. And we've now opened that widely as social distancing recommendations have gotten wider. So the short answer, Shell, is that a person literally does not have to come in our clinic to get their course of care started.
And I think that one of the things Shell was also asking about was our free online support groups. And those are open to anybody who wants to join in. I'm going to drop the link for those into the chat box as well. And you can participate as much as you want or as little as you'd like. But they're definitely there and open to anybody across the state. You do not need to have a family member engaged with Eleanor. So speaking of family, we've got a great question from Dana Carroll with Fellowship Hall. Dana asks, as we know, addiction is a family disease. Can you explain Eleanor's model and plan to include the family in the recovery process and understanding all the privacy and HIPAA compliance requirements? So I'm going to take that one. And early on in Eleanor Health, at our Mooresville practice, we had a young man whose parents were very excited to get him engaged with our program. And he wasn't sure he wanted medication-assisted therapy. He'd been through several rehabs previously. And he came to us, was actively engaged with our team of therapists, social workers, and saw Dr. Harrison for psychiatric evaluation, and she began addressing his anxiety. He, after about 4 weeks, his parents were sort of frustrated because he wasn't better. And so our LPC at the practice began some family therapy focused on the parents around psychoeducation, around what is addiction. And so engaging the family is critical to us. So in this situation, the parents were actually having stress in their relationship because of their son's substance use disorder. And helping them understand what he was going through was essential. Eventually bringing that family together in therapy was also a really important part of their recovery as a family. Some more questions. Let's see. Ben Millsap asks, what specific evidence-based practices do you utilize in your general treatment and SAIOP programs? From the medical standpoint, early access to medication-assisted therapy when appropriate is critical. And that requires accurate diagnoses up front and an understanding of any psychiatric comorbidities that we need to address. From the behavioral health side, we use a variety of different tools in therapy. And seeing who's up. Brandy, do you want to take that one and talk about our therapy more specifically?
Sure. Thanks, Steve. So some of the models that we will use are motivational interviewing to help patient where they are at and move forward. Unfortunately, a lot of times community members are struggling and we have to really work where they are. So a lot of times we'll use the motivational interviewing, cognitive behavioral therapy, solution focused, are just some of those that we will use during the course of individual and also group therapy, along with some psychoeducation that we will be doing during group.
Great, thank you very much. Next question is from Akusa. I'm gonna mispronounce this and I apologize in advance. Ajabu. Does Eleanor Health offer any type of intervention services where staff would come and meet someone in the home? Brandy, you're up on screen. Why don't you take that one as well? So the question was about, do we come out to the home? What kind of intervention services can we provide?
Well, the good thing is with the CRPs, the community resource partners that we have, we are going to be trying to do some more community work as compared to just being in the office. So the good thing is we can work with the community member in a place that is, good for them as well as the staff member. So we will be able to work on some activities out in the community.
Great. Next question that comes up is the video made mention about a different payment model. And how are you creating a value-based program or payment model? A little bit off of what we sort of do in the practice. And Corbin, can you take this one?
Sure, happy to do it. So the unique payment model, value-based payment model, is really a foundation of which we were built upon. So typically in healthcare, providers are paid based on the number of services, the volume of services that they are providing. And so there's a misalignment often around providing services that may not be necessary to achieve optimal clinical outcomes. So what we've developed is a model in a partnership with Blue Cross, and we have models with several other payers that really incentivize our outcomes. So we get paid based on the positive outcomes that we have with our community members. So we're not paid based on the number of different services that were provided. Really incentivized to keep patients in recovery. So the retention and recovery, that long-term approach that we have, treating recovery as a chronic condition, is how we built our payment model. The other part of our payment model that's unique in North Carolina is that we're really trying to engage patients in treatment who wouldn't normally be seeking treatment or haven't been seeking treatment, but it's obvious from their activities that they would benefit from treatment with Eleanor. And so we're outreaching and proactively engaging those members to come in and seek treatment with Eleanor. So those are the key components to our payment model. I think the final one I will say is that we have skin in the game, as for lack of a better term, which means that if we are not successful in achieving those outcomes, we are not paid in the same way. And so I think that's a really important piece of our model as well.
Great, thanks, Corbin. And Nzinga, this one's going to come to you. Amy Upham asks, what is your protocol for benzodiazepine dependence?
Ooh.
One of our favorite clinical questions.
Yeah, it's difficult. Thank you, Amy. So for everyone on the line, benzodiazepines are quickly becoming the next epidemic. People really don't understand how dangerous these medications can be. So that's like Xanax, Ativan, Klonopin. And what we find is that individuals are often using opioids and benzodiazepines together, which substantially increases the risk for overdose death. So we apply our harm reduction model to benzodiazepine dependence like we do with all other substances. What we know is that heroin plus Klonopin is more dangerous than buprenorphine plus Klonopin. So we do not let the presence of a benzodiazepine use disorder prevent us from starting MAT for OUD. We work with that person with motivational enhancement to do a benzodiazepine taper, psychiatric evaluation, treatment of what is usually a co-occurring anxiety disorder with medications, but very much so with our clinicians and our community recovery partners, and then work to help that person resolve both their benzodiazepine use disorder as well as any other co-occurring substance use disorder.
Great, thank you. And it's something that we wrestle with both in primary care and in subspecialty care. Shell McCall asks a great question. Will the full spectrum of wraparound services continue to be available virtually even after social distancing is lessened, so that community members in rural areas can continue to benefit even if an Eleanor clinic is not easily physically accessible? So Shell, we live in the same community, but Shell's not a plant. She's a great friend and a huge advocate for substance use disorder treatment and leads the Mitchell-Yancey Substance Abuse Task Force. So Shell, yes, as a rural family doc, being able to continue to provide services to people after the pandemic has broken is going to be essential to what we do. Bringing services to someone in a time of crisis and then taking them away because the pandemic is gone and saying now you need to drive 50 miles is against the Eleanor model. We really want to make sure that people have access to services on their schedule. We have a set of evidence-based tools that we love to use. And we want to customize treatment and how we deliver that treatment to the way that's best for people who come to seek care with us. So Harriet McNeil Moore asks, what sources or providers does Eleanor generate referrals from for services? And Harriet, I'll take that one. We will take referrals from anyone, from family members, from primary care docs. We're working with Duke University in their inpatient unit, where they're starting patients on buprenorphine in the hospital and then transitioning into our Durham practice. So we're open to referrals from anyone. If you have a concern, please refer the patient. And if we can't provide them with the services that they need, because they need a higher level of care, our team will make sure that they receive the care that they need in an inpatient setting, in a partial hospitalization, in detox. And then Eleanor is going to be there when that individual returns to their community so that we can continue to support them. Thanks. Another question. What steps do your clinics take in order to reduce stigma and make the individual feel that they are part of the Eleanor family? And Candace, you want to take this one?
Sure, thanks, Steve. Everyone that comes into an Eleanor Health clinic, we just want to make sure that we wrap our loving arms around them, that their experience is different from any other experience that they have had. There's so much stigma attached to seeking help in general, and we don't want to be another barrier to them accessing care. And so when an individual gets off the phone with us, we want them to feel like they've just received a warm hug. When they are in our clinics, we let them just come and hang out if they've had a bad day, even if they don't have an appointment. They can just come, get some coffee, get some snacks, and just be around individuals who support them. That's the Eleanor way, and that is something that every single member of the Eleanor team embodies. It comes from the leadership through everyone in the Eleanor Health clinics. And that is our mission, that is our goal. We're constantly doing surveys to check ourselves to make sure that if there is something we can do different, whether it's we don't have hot sauce in the cabinet and you like to have hot sauce on your chicken when you come in, or use our microwave, we're constantly doing things to make sure that individuals feel welcome.
Great. Thank you very much, Candace. Really appreciate it. So I appreciate everybody coming out tonight to listen to us and ask great questions. I want to thank Conrad Levitt, a Burnsville native, for putting our video together for us. He did a great job. So we're available for more questions down the road. I'm going to drop our Asheville practice email into the chat box right now. And thank you very much for coming tonight. In closing, wanted to send this back over to Corbin and then to Nzinga for some closing comments.
Thank you, Steve. Honestly, we couldn't have ended it better than Candace answering that question really about the Eleanor way and how we look to work with our community members and really address the whole person needs. Really appreciate, it's actually incredible the number of attendees that we have and the activity that we've had. We weren't able to answer all the questions here, but as Steve said, please feel free to email us at our Asheville clinic. Brandy will be on point to respond to those. But really just wanted to thank everyone for coming. We're really excited to be part of Asheville, part of the North Carolina community, and really doing all we can, especially during these times, to help people with addiction live amazing lives. I'm gonna hand it to Nzinga with any final words.
Thank you. I'll keep my final words very short, which is just thank you all. This was absolutely amazing. I did see one other question in the box that said, how long is a person a member of Eleanor Health once they join? And the answer is #Eleanor for life. So once you join our community, you are always a member of our community. In terms of treatment, we like to keep people no less than 5 years, but we intend to keep our relationships for a lifetime. So thank you all so much for joining us. And with that, I think we'll sign off.
Thank you very much, everyone, for coming. Have a great evening. Bye.